We want to hear from Kara Murphy, President of DuPage Health Coalition, about Access DuPage, and then provide a minute to figure out how we're going to collect information from all of the folks on the call. So Kara, I want to introduce you and offer to share a screen if you'd like.
No need. I will do so without a screen, but we'll say that our website has a wealth of information that gives more detail about what I'm talking about, and that's at www.accessdupage.org. But good afternoon, everybody. I know a lot of folks on this call, but not everyone, so look forward to meeting you in person one day when we get to do that again. A few things that I want to mention that I heard referenced. Because VNA isn't here, but I have had some conversations with them about their testing capability, I want to share that similarly they have those resources in English and Spanish. They are also by appointment. They're doing it primarily in their Carroll Stream location, but they did identify that if people have a challenge around transportation, they are willing to work with folks to be able to get them to that location. If they're, DuPage is a big county and it can be hard for folks to get from one portion to the other. They are also appointing for those visits as well, so it's a request to call first. I'm actually going to talk very, very briefly about 3 different programs. The Access DuPage program, which as Melissa had referenced, is the Clinic Without Walls model of a free clinic, and then also our Silver Access program and the DuPage Dispensary of Hope, because all of those programs are likely to be a potential resource for individuals. Oh, thank you, that's perfect. A potential resource for individuals who are low income, uninsured, or underinsured. We also serve a pretty disproportionate and heavily immigrant and refugee population. That has always been the case for us, became even more so after the Affordable Care Act launched and meant that some of the folks that had previously been uninsured in our community now had insurance. Our Access DuPage program serves about 5,000 to 6,000 patients per year. It's currently serving a little bit fewer than 4,500 patients at any one time, but we anticipate that number to grow over the course of this year, unfortunately, and we are ready, willing, and able to accept that growth. That program is specifically for people who don't qualify for any other form of federal, state, or employer-sponsored health benefits. So it's really intended to be a program for folks who have no other meaningful resources and also have income at or below 200% of the federal poverty level. They have to live here in DuPage County. How they came to live here in DuPage County is not material to us. About 95% of the patients in that program speak Spanish at home, and about 3% of the remaining 5%, 3%, almost 4% speak another language other than English or Spanish. A very small number of the people served by Access DuPage are English speaking at home. So this really is a program for immigrants, and happy to be that. That program, I want to shout out to our FQHC partners that are on the call, because they really are a big piece of what makes that program possible. They are, by and large, the primary care providers for the Access DuPage program. We enroll people, we assign them to a primary care medical home at one of our FQHCs. We provide a small subsidy to the FQHCs to make it easier for them to provide services and also to keep the co-payments at those FQHCs very low. But then we coordinate all of the other health services that they might need. All of the diagnostics, x-ray lab and testing, pharmacy access. We have a pharmaceutical program where patients can go to virtually any pharmacy in DuPage County, pay small co-payments, and we pay the remainder of the cost of their medications. Every hospital in DuPage participates in the Access DuPage program and writes off the charges for members of Access DuPage when they present at the hospital, whether they're presenting for a brief visit or whether they need to be admitted and treated for a longer period of time, have a surgery, an emergency room visit, etc. Patients enroll in that program, they document their income and their address, and we enroll them typically for 12 months at a time and then re-enroll them as they continue to need services. And sometimes we'll enroll people for less than a year if we have reason to believe that they're going to qualify for another program before that year is out. But right now, especially recognizing that it is a lot harder for people can't physically come to us. We're doing all of our applications by phone. We're actually calling all of our established patients and re-enrolling them by telephone, and then working through the process of having them mail us the documents that we need. But we're giving them a lot of grace, recognizing that it's much harder for them to get us those materials and that it's also very important that people stay enrolled in programs like these right now. We don't want people, only as a last resort are we going to take someone and move them out of our programs. We'd much rather keep them and continue to give them some extra time to get the resources that we need. The other two programs I want to talk about real briefly, one is Silver Access, and Paula was talking previously about the ACA Marketplace. And Silver Access is a program that's pretty unique here in DuPage County that coordinates additional premium assistance for low-income people who are enrolled in ACA Marketplace plans, but who, without some additional assistance, would probably fall into one of two categories. One, they might actually stay uninsured. Of course, they're not required to be insured under the ACA any longer. There's no more of a mandate. So we don't want folks to be uninsured, especially when they qualify for ACA Marketplace coverage. The second challenge that we had was that people, because their incomes were low and money was tight, were choosing the least expensive insurance that was available on the marketplace, and that insurance is really not a good fit for someone who is low income. The deductibles are high, the cost sharing is high, the premiums may be very low, but they can't really get meaningful access to care. And so our program actually helps them to purchase a higher quality health insurance by subsidizing the cost of that premium. They continue to pay the out-of-pocket costs themselves. Historically, that program has actually been capped, but we have opened that program up through what's going on right now with the pandemic. We've actually enrolled another 56 people since April. In that program, we've got about 575 people enrolled right now. We have not set a new cap. So if you have individuals who have recently sustained an employment loss, or perhaps who were enrolled in an ACA Marketplace plan previously, but their income was too high to qualify for our kind of assistance, maybe now they're in a position where unfortunately they're still enrolled in that insurance, but their income has dropped. Please encourage them to call us at the Access DuPage offices, the DuPage Health Coalition offices, so we can screen them. We may well be able to help to pick up a piece of the cost of those premiums that they're paying to make it a little bit easier for them to make ends meet. Similarly, we have no cap on enrollment in the Access DuPage program. In the past, we've served as many, actually in 2008, 2009, during the recession, for very unfortunate reasons, our enrollment spiked, and we served more than 15,000 people that year. So we are ready, willing, and able to grow as we need to be able to serve the needs of the patients. The last thing I want to talk about is the DuPage Dispensary of Hope. The DuPage Dispensary of Hope is a program that we operate in cooperation with a national nonprofit based out of Tennessee. But this is a free pharmacy program. The only qualifications are that if someone needs to be at or below twice the federal poverty level, and they need to be uninsured. Whether or not they're eligible for insurance actually isn't relevant for the DuPage Dispensary of Hope. If they don't have insurance and they meet the income guidelines, they don't even need to be a DuPage County resident. They can use that pharmacy with a lot of resources available on our website as well about the Dispensary of Hope. You can see a list of all of the medications. We encourage folks to call pharmacy first. It's located in Wheaton in the first floor of the convalescent center. We encourage them to call because even if a medication is listed as being available, because medications come in and out on a weekly basis, we want to make very certain that someone doesn't make a trip over there only to find out that they're temporarily out of stock of a medication. So if the pharmacy knows that they're coming, they can make sure that they have the medicine available. But there's zero cost for any of the medications that are dispensed through Dispensary of Hope. And that becomes all the more critical right now, either for people that find themselves temporarily uninsured or who have been uninsured for a period of time, but were paying small co-payments or paying out of pocket for medications, and now they find themselves without the resources to be able to do so. It's a great resource. It's available on an ongoing basis. There are about 225 medications that are available through the DuPage dispensary. So I could say lots more, but I think I will stop, available for any questions. What would be most helpful to us, I just want to end with this, is that, you know, in this time of social distancing, it's so much harder for us to get the message out to the community, especially people who are newly struggling, who perhaps were doing okay a few months ago and now find themselves in crisis. So we would really appreciate the assistance of all of our community partners in engaging with their networks of individuals that are seeking care for them. We would love to be able to share our brochures, to be able to share social media posts, to do whatever we could to really get the word out to all of those individuals who have seen some sort of change in their status through the result of this pandemic, so that we can make sure they're getting connected to care. No one should be without access to health care right now. This is a scary time for all of us, but just imagine how terrifying it is if you aren't insured and you don't have access to care. So thank you in advance for any help that you can provide us to be able to do that work. We would love to partner, and folks can reach out to me directly. I'll put my email address in the chat bar.
Thank you, Kara. And I'm reminded after your comments to make one change in what I said earlier with Paula about Get Covered Illinois. This is a message that is really just for DuPage residents because of the resources available through the DuPage Health Coalition. If you've lost that job and it had health insurance and you're eligible for marketplace health insurance, really your first call should be Access DuPage to understand the full range. The Silver Access program that Kara mentioned is a way to get far more bang for your healthcare dollar in DuPage County. It's just a win-win for everyone here. It's like a family member contributing, so another family member can get a higher level plan and much better care and better health outcomes. So thank you, Kara, very much for sharing that.